Hi, my name is Sophia Esteves, and I am a patient advocate for pulmonary arterial hypertension. I am also a support group leader, and today I want to talk to you about mental health. Mental health is becoming more of a concern in our community, and so I wanted to talk to you today about all of the feedback and input that I've been receiving from our community. I'm also a patient myself. I've lived with pulmonary arterial hypertension for 23 years now. So looking back, I remember the life-changing diagnosis. It was so heavy. Depending on when you were diagnosed, you were given a certain amount of time that they were expecting you to live. For me personally, I was told I had 4 years to live and that I needed to stop working. At that time, I was only 21 years old. So it was very hard for me to comprehend what my next steps should be. So in this situation, what I imagine for the future is that patients that are going to their doctors for these diagnoses can be given a referral to maybe go see a therapist and a dietitian, because I feel like no one is prepared for such a heavy diagnosis, right? And we really could use someone that can follow us along on that journey and say, hey, you're going to be okay, or you're doing this right, or let's get you back on track. Just things like that could be really helpful for a patient that's facing a life-changing diagnosis. Also, another big thing that I see is diet. As you know, when you are up against heart failure or the side effects from these medications, it's recommended for you to be on a low sodium diet. And that is very challenging depending on what type of diet you grew up on. So it doesn't hurt to really meet with somebody who studies food and can tell you what types of food your body would benefit from. Because remember that even if you are living with an illness or a disease or this diagnosis, you can still live and choose a healthy lifestyle. So I imagine that, these PH centers could maybe even bring a therapist or a dietitian in-house. So as the patient is receiving these diagnoses, they're also getting a referral to see someone that is working closely with your doctor or their doctor. The next topic would be the treatment options. This is where a lot of patients struggle because it's hard to imagine your life in the future with perhaps a pump this big attached to you. I've met a lot of patients that have really hit a roadblock when it comes to the treatment options. Unfortunately, they all do come with side effects, and they're all going to be different depending on each individual. There's really no prediction when it comes to that. There's a certain group of side effects that you're usually going to encounter, but as far as which ones you will go through, that's really hard to say. So it's kind of difficult for patients to navigate through that, because they feel like, for one, am I picking the right treatment? Is it going to work for me? How am I going to wear a dress? How am I going to wear a bathing suit? How am I going to exercise? How am I going to be intimate with my partner? I mean, you name it. I've had every question across the board when it comes to these types of devices. And unfortunately, this device you see here, it's pretty big. So it's not like I can conceal it, or hide it anywhere, because you're going to see it no matter what. So I think another part of evolving when it comes to our treatment options is maybe considering the size of the device and making it so that it can be concealed, so that patients can feel like they have a little bit more of that privacy when it comes to what medications that they are on. Subcutaneous treatment, that treatment can also be very uncomfortable, and it's very limiting. So that leads you into the side effects, right? The side effects is another very big issue for PAH patients, especially when you're just starting out and you don't know what to expect. You wake up one day and you go, whoa, what's going on here? Because it's not just the PAH and the shortness of breath and all the things that come with it, but now it's this whole other group of discomfort that comes with it, like a package deal. And then you're left questioning, is this what it's going to be like? So really, you're taught to treat the symptoms of the side effects, because obviously you cannot come off of your PAH medicines if you want to be successful at treating this condition. So, a lot of times you really just have to focus on how can I deal with these side effects in a better way. Nausea, diarrhea, headaches, jaw pain, nerve ending pain. Those are all some of the side effects that come with the current treatments that are available for PAH. And I know just saying that, it sounds discouraging. It also sounds like a lot of downtime, a lot of time where you wake up and you have a big to-do list, but you cannot necessarily get to much of it because you're not feeling well. So in those moments, you are left to choose yourself. You have to put yourself first. And that is a really hard thing to do depending on your life, because each patient is different. Everyone has different obligations. Perhaps you're someone who has to go to work. Perhaps you're someone who is a full-time caregiver for someone else, or you're a mom, or you're all three. So there is really a lot of downtime that comes with dealing with these side effects. And then really it also leads to understanding that you do have areas of disability, right, that you have to accept or learn to move through. Perhaps one of those is parking in a handicap spot. You can face a lot of discrimination when you do not have a visible condition. This disease is invisible for the most part, unless you're carrying around something that's visible like this. But most of the time, you're going to be met with people who don't understand it. So perhaps in those windows of opportunity, we can share what PAH is. Even if you're met with somebody who doesn't have the best approach, maybe you can change it for all of us and just let them know a little bit about the condition itself. So there are also some other things. It's a lot of layers, right? Another layer that I've seen a lot, because our community is mostly women, is pregnancy. And what happens if you are this woman that, just got married and she's starting off her career and just graduated college, and her spouse are talking about having children and the white picket fence or whatever it is that you imagine in your life. But all of a sudden you're told that your life is going to change, that you may not live a full life. And if you do, it's going to come with challenges and acceptance. And one of the things that you have to accept is that you will not be able to have children. Now, you will hear stories of women who have carried to term, but of course it's not advised because of the risks that are associated with carrying and also after childbirth. So that is definitely something that people have to find other options for. Maybe adoption, things like that. Surrogacy is another one that I've heard of and actually seen. I have a couple of friends who went through a surrogate mother, and I also have some friends who have adopted children, and everyone's doing great now. But it's just a matter, again, of acceptance, right, of the things that we cannot change and focusing on what we can. Intimacy is another one that comes up a lot. I get asked by patients all the time, how do they approach that? We do have men as well that are diagnosed with PAH. And, so I have both men and women asking me, hey, what does that look like when you have this line that is sewn into your chest and it's attached to this pump? Or what does that look like if I have all this discomfort from my sub-Q therapy? And so there's, of course, different types of intimacy that you could explore. I mean, it's not always one type of intimacy, but there's, conversations, there's flowers and chocolates, there's nice vacation trips, there's things that you can do. So know that there is hope for still having a beautiful life and a wonderful relationship. Just may take a little bit of shifting and, again, acceptance of those things that we can't change. So moving forward, another thing that I've seen a lot is your social groups, right? We all belong to different social groups. Maybe you're still working, you're going to school, or you work at a school, you're in a church group, or you're in a band. There's all different types of people in this world that belong to so many amazing circles. And it's really hard to go in to those circles and explain to them this invisible disease that sometimes we ourselves have trouble explaining. That creates a lot of mental health issues because we feel like we're letting them down. Whenever we have, let's say you're supposed to go in for a shift at work and you wake up and all of a sudden you're dealing with these side effects and you just cannot go anywhere because you don't feel well. And now you're having to call in to work to say, I cannot go to work. And then maybe as a result of that, your employer says, hey, we cannot use you here anymore. And then you're left with another challenge, which is another layer to managing this disease, this condition, and still trying to live a full life. So a lot of patients have had to go on disability because they have not been able to work because they don't feel well enough. Other patients have to stop working because they have to get a transplant, a double lung transplant, and that will definitely take some time and recovery. So, those are a lot of topics that I went over, that I covered. Hopefully, if you're a patient that's watching this, you can relate on some level. And I would just encourage you to be as transparent as possible with your groups, with your family, with your friends, because really we cannot expect someone to help us or understand us if we don't explain what we're going through. Others really are wanting to understand what we're going through. So know that it's important for you to share that. And I can say with much hope that when you decide to start sharing these things, life will get a little bit easier. People really are good down to the core, or want to be, and want to help. Everyone has a purpose, and so try to accept that help. Look for a support group. Find your tribe. Maybe the group that you were a part of before isn't as understanding as you'd hope that they would be, but it doesn't mean that there is not other groups that you could be a part of. So I personally lead a support group here, and I can tell you that sometimes patients will come and sometimes they won't. And we're not going to hold a grudge. We're not going to be upset because we understand that you are facing your life challenges, whatever they look like, and the door stays open. Also, try to create healthy boundaries. Say no with a period at the end. That is very important. That's an important step in this journey, is learning how to put in place boundaries that make you create this level of comfort in your own life. For example, me, myself, I know in the early morning, I don't feel well from the medication. So I don't schedule any appointments early in the morning because I already know I'll have to cancel them. So once I put that practice in place, things got a little bit easier because I reserved time in my own life to manage my side effects. And then once I was done with it, then I could jump back into my to-do list or my obligations. I also would encourage you to have an open line of communication with your doctors, with your doctor's staff. I know a lot of patients are on a texting basis now with their doctors or their doctor's nurses, and that's because of the sense of urgency that is married to this condition, right? They come together. It's a package deal, and so whatever it takes to make you feel comfortable living with this condition, I encourage you to look for that type of communication that would make you feel that way. You can also look for a patient advocate. People like myself that we spend a lot of time online. For me, I spend a lot of time on the platform Instagram, And I get patients who message me from all over the world. I mean, you name it, Dubai, Switzerland, Costa Rica, all over the world. And they're asking me about just different things that maybe they didn't feel comfortable asking their doctor about or their partner about. So you can definitely connect with people and with staff members and doctors. There's a whole group of people that are out there to help you. It's just a matter of you finding which ones do work for you. When you connect with your doctors, make sure you can have conversations about what medications actually work for you and what your goals are. Like, what do you see for yourself in your life as far as like quality of life, where you want to live, where do you want to travel, and they will help you to accomplish those goals. Maybe you're on a treatment that just isn't working for you in this period of your life because you're doing a lot of traveling. Ask them what other treatment options are available and what that would look like. Ask your advocates that you've connected with or your support group members what that would look like so that you can find something that will work for you. Personally, I've tried every type of therapy. I've tried oral, inhaled, subcutaneous, and intravenous. And I did that so that I could find out for myself how my body would react and respond to these different treatments. And in doing that, I have been able to narrow down a window of what type of treatment works for me. And when I say works for me, I mean which type of treatment will allow me to still be happy and live the life that I imagine for myself, that I'm creating for myself. So in that life, some other things that I could share before I say goodbye are the healthy lifestyle that we started out with at the very beginning of this discussion. Exercise. I know exercise can sometimes sound scary to a patient with PAH because you imagine your heart overworking or where you're going to get the oxygen to breathe through an entire workout. So maybe one option that could help would be to get prescribed oxygen so that when you do try to exercise, you feel a level of comfort that is provided by that extra layer of oxygen. And you know that maybe your heart's not working as hard by doing that. So just find little things that work for you, but I would say don't completely throw those ideas out the window. Try it, and if it doesn't work, try something else. Try also different hobbies. You know, you may have done all of these things at one time, and now that you're on this treatment or you've had a procedure or whatever challenge you're facing, you might not be able to do those same hobbies, but it doesn't mean you can't do something else. So look at it as an opportunity to get to know yourself a little bit better when you're limited on doing the things you were so used to doing. Now you can try things that are new to you, that are going to make you feel excited and give you something to look forward to. I've really enjoyed having the opportunity today to speak to all of you, to speak to patients, doctors, nurses, everyone that's involved in making our community better and giving us a voice to be able to understand what things could help us more in the future. So again, my name is Sophia Esteves. I hope you will find me on one of my platforms so that we can connect and talk a little bit more about living life with PAH and overcoming our mental health obstacles.